Hi, I'm Donna Edwards, and in this presentation we'll be discussing first episode psychosis and co-occurring substance use disorders. You may ask, what is first episode psychosis? Psychosis refers to a condition that makes it difficult for an individual to differentiate what is real and what is not. When people experience psychosis, their thoughts and perceptions are disrupted. They may perceive things that others do not or hold beliefs about things that are not true. Although psychosis can be experienced at any age, symptoms most commonly begin between the ages of 16 and 30. Although the specific definition varies across clinical and research settings, first episode psychosis is generally regarded as the early period, up to 5 years, after the onset of psychotic symptoms. In many cases, first episode psychosis impacts young people just at the time when they are preparing for and establishing autonomy as adults. Psychosis is a condition that disrupts a person's thoughts and perceptions and makes it difficult for an individual to differentiate between what is real and what is not. Symptoms of psychosis may include delusions, false beliefs, hallucinations, seeing or hearing things that others do not see or hear, incoherent speech, memory problems, trouble thinking clearly or concentrating, disturbed thoughts or perceptions, difficulty understanding what is real, poor executive functioning, the ability to use information and make decisions, behavior that is inappropriate for the situation. The disorders in which psychosis may occur. Examples of disorders with psychosis include schizophrenia, schizoaffective disorder, schizophreniform disorder, brief psychotic disorder, delusional disorder. Other disorders, such as major depression or bipolar disorder, may include psychosis as a severe secondary symptom. The first experience of psychosis can be a time of fear, stress, and uncertainty for young people and their families. Because of the stigma associated with mental illness, young people and their families find themselves alone and do not know where to find help or support. During this stressful time, young people may also experience depression, sleep disruptions, anxiety, and isolation from others. Many young people have trouble at school or work because it becomes difficult to concentrate and complete assigned tasks. School systems and workplaces may also lack the capacity to support or accommodate young people with psychosis, which can limit their participation in education and employment. Young people with first episode psychosis may have difficulty maintaining relationships with family and friends because they no longer feel safe going out or engaging in social activities. Family members and friends may not know what psychosis symptoms are or how they can help. Most families will not have much information about psychosis, so the path towards correct diagnosis and appropriate treatment can be long and difficult. The longer symptoms go untreated, the greater risk of additional challenges, such as hospitalizations or legal problems. Young people in the United States typically experience symptoms of psychosis for more than a year before receiving treatment. The time between first experienced psychotic symptoms and the beginning of appropriate treatment is referred to as the duration of untreated psychosis. It is important to reduce the duration of untreated psychosis because research shows that the earlier young people find and engage the effective treatments, the sooner they may feel better and resume activities and goals that are important to them. The shorter the duration of untreated psychosis, the greater the likelihood that young adults will experience positive outcomes. What are substance misuse and substance use disorders? There are different ways people can be affected by substance use. Experimentation with substances and recreational substance use is common among adults, and substance use, which is infrequent or moderate drinking, is practiced widely and does not cause problems for most people. In contrast, substance misuse refers to a pattern of drinking or drug use that confer high risk for negative consequences. Binge drinking, defined as 4 drinks for women or 5 drinks for men over approximately 2 hours, is an example of substance misuse that is associated with increased risk of health, interpersonal, and cognitive problems in both the short and long terms. Regular marijuana, cannabis, is another example of substance misuse that can increase one's risk for health problems and cognitive impairments. For some, substance misuse can develop into a substance use disorder. Substance use disorders can include the misuse of a variety of drugs including alcohol, cannabis, cocaine, heroin, hallucinogens, inhalants, opiates, prescription pain relievers, tranquilizers, stimulants, and sedatives. Individuals often experience the negative results of substance use disorders over time as their ability to function declines. Research studies have investigated the impact of specific substances, especially alcohol, cannabis, and tobacco, on psychosis symptoms and other health and treatment outcomes among people experiencing first episode psychosis. Alcohol use is related to greater non-adherence to medication, lower quality of life, and reduced social functioning. Research shows a connection between cannabis use and psychosis onset for some young adults, while regular cannabis use often predicates the onset of psychosis. Young adults with first episode psychosis who continue to use cannabis over time are more likely to experience significantly poorer outcomes than those who either have never used cannabis or those who have used cannabis but stopped after engaging in treatment. For these reasons, cannabis use in particular is a target of treatment in first episode psychosis. Tobacco use is associated with cardiometabolic problems among young adults with first episode psychosis and thus is also an important treatment target. A substance use disorder is defined as continued and frequent substance use despite experiencing a range of negative consequences, including the substance in larger amounts over time, unsuccessful attempts to cut down or stop using, spending a lot of time engaging in substance use or recovering from its effects, and giving up important social, occupational, or recreational activities because of substance use. Now let's discuss first episode psychosis and co-occurring substance misuse or substance use disorders. Determining prevalence rates of substance misuse and substance use disorders in young adults experiencing first episode psychosis is challenging for a number of reasons. Many studies report prevalence rates for both substance use and substance use disorder without carefully separating the two. Studies differ in whether they report current substance use or disorder or lifetime substance use or disorder. Studies assess substance use differently, and in that some use structured diagnostic interviews and others use checklists or less rigorous measures. And the sample can vary across studies in that some include clients who are entering mental health treatment, while others include clients who have been in treatment for longer periods of time. As a result, these methodical differences, we see wide variability in prevalence rates of substance use and disorder in young adults with first episode psychosis. Despite these methodological issues, some conclusions can be drawn from the research literature. First, most young adults with first episode psychosis have tried or used cannabis, alcohol, or tobacco at some point in their lives. Among young people aged 18 to 25 in the United States, approximately 15.1% had a substance use disorder in 2016. Of these, about 6.1% had a co-occurring mental illness and a substance use disorder, and an estimated 2.1% had a co-occurring serious mental illness and a substance use disorder in 2016. 13 to 51% of young people who have had first episode psychosis have a co-occurring substance use disorder at the start of treatment for psychosis. Use is defined as recent use, generally in the last month. Current substance use disorder is defined as meeting diagnostic criteria in the last 3 months. Lifetime substance use is defined as ever using a substance. Lifetime substance use disorder is defined as meeting diagnostic criteria during any 12-month period other than the last 3 months. Second, fewer but still many young adults with first episode psychosis report use of cannabis, alcohol, and tobacco at entry to first episode psychosis treatment. Third, lifetime alcohol and cannabis use disorders are fairly common among young adults with first episode psychosis. Fourth, use of other substances such as cocaine, opiates, other stimulants, and hallucinogens has been less widely studied, but across samples, rates of use and disorders appear to be much lower than those for cannabis, alcohol, and tobacco. Coordinated specialty care. Recovery is possible for young adults who experience first episode psychosis. There are effective treatments that help young adults reduce and manage psychotic symptoms, re-engage with friends and families in ways that are comfortable and meaningful to them, and work towards their personal future goals. Interventions including low-dose and antipsychotic medications, cognitive and behavioral psychotherapy, family education and support, and employment and educational supports can help improve psychotic symptoms and functioning in their daily lives. These treatments can be provided by a range of mental health practitioners in outpatient and rehabilitation settings. Programs that introduce these evidence-based components over a 2 to 3 year period following a first episode of psychosis have been shown to have beneficial effects on outcomes over time. Integration of treatment approaches for substance misuse and substance use disorders in the context of treatment for first episode psychosis. Young people experiencing first episode psychosis, like other young adults, may use alcohol or some drugs infrequently or socially and in ways that do not cause problems for them or impair their functioning. However, substance use will reach levels of misuse or disorder for some young people experiencing first episode psychosis. It is important to discuss an initial assessment to determine whether a young person uses substances at all, their personal patterns of use, and whether substance use is causing problems or impairing functioning. Clinicians should ask questions that assess the frequency, quantity, and types of substance use and inquire about the young person's specific reasons for use and personal thoughts about change. For individuals with psychotic disorders, treatment of substance misuse or substance use disorders by separate, unconnected clinicians is rarely effective. Poor follow-through on referrals to other agencies for treatment and lack of coordination between treatment providers contribute to high rates of dropout from traditional substance use treatment for people with psychotic illnesses. In the last several years, several general principles have emerged as important providing treatment for substance use disorders in the context of first episode psychosis. Research indicates that treatment for co-occurring disorders should be provided in an integrated and seamless way. Challenges of addressing substance use disorder in context of first episode psychosis. Screening and diagnosis. The effects of alcohol and drugs such as stimulants, cannabis, and hallucinogens can mimic symptoms of psychotic illness. This can make it difficult to reliably assess and diagnose these conditions. Substance use disorders are often missed in people with a psychotic illness. Of routine assessment of these issues is not incorporated into standard practice. Access to care. Not all young people and their families will have access to CSC programs. Currently, these programs are generally located in population centers of over 500,000 people. The issue of access affects both youth and adult health systems, as well as mental health and substance use service systems. In addition, a lack of information about first episode psychosis within the general public and among institutions that serve young adults can impede timely access to care and may prolong the duration of untreated psychosis. Resource-rich programs like CSC may not be widely available for young people who need them, particularly in rural areas with underserved groups. Coordinated specialty care in rural settings. Workforce limitations and the lack of accessible healthcare services in rural areas can make it challenging to implement coordinated specialty care for first episode psychosis. The shortage of available staff can be particularly pronounced in rural and hysterically underserved areas, and providing team-based treatment across wide geographic areas can be difficult. Research illustrates the importance of informal and formal support networks for individuals experiencing co-occurring disorders. Telehealth can connect rural and frontier providers to program-specific expertise.